Hi, this is Dr. Perry Carpenter. I'd like to thank you for taking the time to join me on this week's video. On this week's video, we're continuing with our ongoing series entitled Recurring Themes in the QME Evaluation. And today we're starting part 2 of this series. Now, in part 1 of this series, we talked about the recurring themes that you're going to encounter with regards to your causation argument. We talked about the recurring themes that you're going to encounter with regards to denied claims that require a causation determination from you. We talked about the recurring themes in the causation section of your report that you're going to encounter over and over and over again. And if you did not have a chance to view those series of videos, I recommend that you go back and review those, because it's my experience and my observation that many doctors do not fully understand their unique role in the causation determination in a denied claim. Many doctors are unaware that the purpose of their evaluation is simply to provide a determination, yes or no, for the compensability of the claim. These are these are evaluations that are ordered under Labor Code 4060, the so-called compensability examination. And in consulting with doctors on a daily basis, I find that many doctors fail to recognize when they are doing an evaluation under Labor Code 4060 compared to when they're doing an evaluation under Labor Codes 4061 and 4062 for all other issues aside from compensability. Other issues such as permanent and stationary, such as permanent impairment, such as apportionment, such as need for future medical care, etc. All those other issues are separate and distinct from the Labor Code 4060 evaluation, whose sole purpose is to determine compensability. And it really becomes quite a simple scenario to solve when you understand the recurring themes that you're going to see time and time again in these compensability evaluations. So that was part 1 of this program. In today's session, we're beginning part 2 of this program, and I want to share with you in our next several video discussions, I want to share with you the recurring themes that you're going to encounter over and over and over again with regards to your examinee's medical treatment. And today, we're going to talk about failed treatments and examinees who fail to cooperate with the treatment program. And in our next session, I want to talk to you about a critical topic also related to medical treatment, and this has to do with examinees who pursue medical treatment outside of the medical provider network. And again, this is something that you're going to encounter in denied claims, so it's important that you recognize what's happening, and it's important that you understand the big picture scenario of what happens when an examinee pursues medical treatment outside of the medical provider network. And what I have to share with you in these next couple discussions, I'm certain are going to blow your mind and are going to open your eyes up to a segment of this industry and the work that we do that you perhaps may have never known existed. So that's going to blow your mind. So I want you to stay with us over the next several sessions as we continue to develop the recurring themes that you're going to encounter time and time again in the QME evaluation. Now, to set the tone for today's discussion, I want to talk to you about failed treatments and examinees who fail to cooperate with the prescribed treatment program, with the diagnostic studies requested throughout the treatment program, and also examinees who fail to cooperate with your QME evaluation. And I'm sure this is going to ring true and be consistent with your observations and your experiences with injured workers over the years. Now, when it comes time to do your qualified medical evaluation and the examinee is permanent and stationary, If you examine the examinee or the applicant and you determine that the examinee qualifies for a permanent impairment rating, duh. I mean, how many examinees do we ever encounter that don't qualify for a permanent impairment rating? I never see a report wherein the qualified medical evaluator provides for 0% permanent impairment. It seems that injured workers in California's workers' compensation system always qualify for a permanent impairment rating. And when you think about the big picture of what's happening when you have an examinee who qualifies for a permanent impairment rating, what that means is that you have an examinee who's failed to fully recover to pre-injury condition. When an examinee fully recovers to pre-injury condition and they're fully recovered from the effects of the industrial injury, they don't qualify for a permanent impairment rating. Well, in California workers' compensation, it seems that every single examinee gets a permanent impairment rating. So what that indicates is that the examinee has failed to recover to a pre-injury status. Now, if you think about this, this may come as a bit of a surprise because in our clinical practice, we're used and accustomed to having patients, not examinees, patients, who respond to our treatment programs and who go on to fully recover and enjoy a pre-injury level of function. They recover, they respond, they get well. But in workers' compensation, no, no. Examinees in the workers' compensation, for some reason, fail to fully recover to pre-injury condition and thus qualify for a permanent impairment rating. Have you ever thought, even for a moment, about this great disparity between the results enjoyed by patients in your clinical practice compared to the sad, dismal results that are accumulating in patients within the workers' compensation system? Have you ever stopped to think about this great disparity? So that's what I want to investigate with you today. Why is it that examinees in the workers' compensation system fail to fully recover? They fail medical treatment despite time, despite medical treatment, despite work restrictions, despite periods of total temporary disability, all of which combined are supposed to provide an atmosphere wherein the examinee can recover from the effects of the industrial injury, and yet we're encountering examinees in our qualified medical evaluation who tell us that despite the time, despite treatment, despite work restrictions, even despite total temporary disability, their problems have failed to fully recover and they qualify for a permanent impairment rating. Why is that? That's our topic of discussion for today. Well, in order to understand what's happening behind this phenomenon, it's important that we understand a few things about examinees in general. Now, in Chapter 18 of the AMA Guides, under the section entitled Malingering, there's several references provided in that section, and one of the references is so poignant. In fact, I recommend that you read all of those references, and we've talked about those in other discussions, but one of the references is so poignant. It tells us that as many as 50% of our examinees, 50%, that's every other examinee, that's 1 in 2, every other examinee, as many as 50% of examinees consider it to be okay, acceptable behavior to exaggerate on compensation claims such as workers' compensation claims, such as personal injury claims, such as state disability claims, such as Social Security disability claims, such as Veterans Administration claims. In other words, on compensation claims, 50% of people by survey consider it to be okay to exaggerate their symptoms and their ability to function with activities of daily living. So it's important that we understand that this phenomenon exists, and we're going to encounter it almost on a 50% or even greater basis. Okay? Well, if as many as 50% of people consider it to be okay, you're going to encounter examinees who will tell you that they failed to fully recover from the effects of the industrial injury, and then therefore they qualify for a permanent impairment rating. And this has to do with examinees who are employing one or multiple of deception, symptom magnification, and or outright and frank malingering. So in order to understand why examinees fail to fully recover to pre-injury condition, it's important to have a basic understanding, some baseline understanding of deception in the qualified medical evaluation, of symptom magnification in the qualified medical evaluation, and in malingering in the qualified medical evaluation. And with this understanding, you're going to have a new realization as to why examinees fail medical treatment and fail to fully recover to their pre-injury condition. And it has to do with a failure of the examinees to cooperate with the treatment program, which is otherwise designed to help them get well and to fully recover from the effects of the industrial injury. So let's talk very briefly about a couple of things related to deception, to symptom magnification, and malingering. Now, according to Webster's dictionary, deception is defined as follows. It is, quote, to cause to accept as true or valid what is false or invalid, to give a false impression. Have you ever had an examinee who you felt was trying to give you a false impression of their true condition? This may include 1, statements, or number 2, physical acts. So that's verbal and nonverbal behaviors, the purpose of which are to propagate beliefs that are not true or are not the whole truth. This may also include omission or withholding of information. And I recently read a book. It was entitled How to Never Be Lied To. How to Never Be Lied To. And the basic philosophy of this book was that liars and lies in general are to be found not in commissions, but are to be found in omissions. The withholding of information or the omission of important information is a technique frequently employed by liars to deceive the doctor into thinking that their condition is not fully recovered to pre-injury condition. Okay, so that's deception. Now, symptom magnification, this is defined as the patient exaggerating or magnifying their actual complaints in order to sell the doctor on the truth of their claims. And according to the AMA guides, as many as 50% of examinees believe that magnifying their symptoms and employing a bit of hyperbole in explaining their symptoms is okay. It's okay behavior. It's socially acceptable, or it's thought to be socially acceptable by as many as up to 50% of all persons. This is done. This is by way of survey. These are the results of some surveys. Now, according to the DSM-4, malingering is defined a little bit differently. The DSM-4 is the Diagnostic and Statistic Manual of Mental Disorders. So the DSM-4 defines malingering as follows. Malingering is, quote, the intentional, let's just emphasize the word intentional. Intentional means willful, and deliberate. It's the intentional production of false or grossly exaggerated physical or psychologic symptoms motivated by external incentives, such as avoiding military duty, avoiding work, obtaining financial compensation, evading criminal prosecution, or obtaining drugs. So with malingering, there's willful and deliberate misrepresentation of symptoms, which is motivated by an external incentive. External incentive. And the DSM-4 provides several examples of external incentives, some of which are operative in the workers' compensation system. Such as what? Such as avoiding work. Can our examinees avoid work by exaggerating their symptoms? Of course they can. Can our examinees obtain financial compensation by exaggerating their symptoms and portraying their condition to be grossly exaggerated from what it actually is? Of course they do. Do examinees malinger and grossly exaggerate their condition in order to obtain drugs? Of course they do. And so the DSM-4 hits the nail exactly on the head with its generic examples. Now let me ask you, can you think of any other type of external incentive that would motivate an examinee to grossly exaggerate their condition? Well, I recently had an examinee that showed me a new external incentive, and that incentive had to do with avoiding financial responsibility. In a case that I recently had, I had an examinee who received notification that his paychecks were going to be garnished. They were going to be heavily garnished for back child support payments that he had failed to pay for months and years time. And so now that he was working, the system had caught up with him, and they were going to attach his wages every 2 weeks and subtract a significant sum of money from his wages in order to bring his back child support payments current. Well, no sooner did he receive this notification that his wages were going to be attached that he filed a claim for workers' compensation and remained off work, not working, to avoid work and to avoid the financial responsibility associated with bringing his obligations current. And there are many other external incentives. Examinees have an infinite number of external incentives that motivate them to do what they do, to motivate them to produce false or grossly exaggerated physical or psychological symptoms because they have external incentives. So always ask yourself with your examinee, what is the external incentive here that's operating that's preventing the examinee from fully recovering to a pre-injury condition? Why is the examinee failing to recover to a pre-injury condition? What is the external incentive operative here? Okay? Now, with regards to malingering, the DSM-4 give us several criteria for malingering. When these criteria are present, when any two of these criteria are present, it's strongly suggestive of malingering. And it's by understanding these criteria that you're going to fully understand why it is that examinees can fail to fully recover to pre-injury condition. Okay, so the first criteria that's strongly suspicious for malingering is a medical legal context of presentation. Medical legal context of presentation. And when you think about that criteria, it might bring up images in your mind of TV shows that you've seen or movies that you've seen that show an injured person in a wheelchair and with a neck collar, and they're in the courtroom explaining about how they were hit by a motor vehicle and how their life has been dramatically changed and altered as a result of this accident. And you might conjure up those images in your mind. Well, that's a medical legal context. The case is involved in a lawsuit. So let me ask you, is the workers' compensation system a medical legal context of presentation? Of course it is. It is, isn't it? In fact, we call our reports medical legal reports. So examinees in the workers' compensation system are already presenting with criteria number one, a medical legal context of presentation. Now, the medical legal context of presentation is quadrupled when the examinee is represented by an applicant attorney. So when you have these examinees, malingering has to be one of your differential diagnoses right off the bat, because the criteria is built in to the examinee and it's built in to the system. Okay? So that's criteria number one. Criteria number two is a marked discrepancy between the stated level of disability or impairment and the medical history. And by the time your examinee makes it to the qualified medical evaluation, complaining of persisting ongoing symptoms and persisting limitations and activities of daily living, they're going to be describing a marked discrepancy between their stated level of impairment and the medical history. The stated level of impairment is going to be inconsistent with the mechanism of injury. The stated level of impairment is going to be inconsistent with the length of time since the date of injury. The stated level of impairment or disability is going to be inconsistent with a person who's received adequate and appropriate medical treatment. In other words, by the time, 12 months, 18 months, 24 months, by the time all this time has passed and they're finally with you at the qualified medical evaluation, when they complain of persisting symptoms, that's representing or is representative of a marked discrepancy between the stated level of disability and impairment and the medical history. So that's criteria number two. Criteria number three, and this is the one I want to focus on today, is a history of lack of cooperation. Lack of cooperation either with the diagnostic evaluation itself, meaning your QME evaluation itself, or with prescribed tests and or prescribed treatments. The examinee has a history of lack of cooperation. So it's important that when you're reviewing the medical records, you scour the medical records for indications as to the examinee's level of cooperation with procedures. Now, let me ask you, in your clinical practice, when patients get well from conditions or injuries, is it because they cooperate with the treatment program? Does it have anything to do with the fact that they cooperate with instructions? Does it have anything to do with the fact that they cooperate with the frequency of treatments that they attend? Does it have anything to do with the fact that they cooperate with home therapy instructions, home exercise instructions, with attending therapy visits, with pursuing diagnostic studies and showing up to those appointments on time? Does it have anything to do with the fact that patients who get well cooperate with the treatment program, right? When we see professional athletes injured and then a month later we see them back on the field or back on the court, do you believe that they're back on the court because they strongly participated and cooperated in the treatment program, which was designed to help them get well and recover from the effects of the injury? Patients and examinees who cooperate with the treatment program, which is rendered by caring and credentialed medical professionals who have a sincere desire to help their patients get well, these types of patients go on to get well. and they recover to pre-injury condition. Well, in the workers' compensation system, many examinees have a history of failing to cooperate, of failing to participate, of failing to follow instructions, of failing to take their medications, of failing to attend therapy sessions, of failing to attend chiropractic sessions, of failing to attend their acupuncture treatments. And they show up at the final permanent impairment evaluation, of course, complaining of ongoing symptoms and activity limitations that qualify them for a permanent impairment rating. And we're going to spend more time talking about examples of how examinees fail to cooperate throughout the history of their entire claim in just a couple minutes. Finally, the last criteria described by the DSM-4 has to do with an antisocial personality disorder, or a person who portrays or displays antisocial personality traits. And we won't talk much about that in today's discussion, except to say that you need to become familiar with antisocial personality traits so that you can spot those when they're present in your examinee. So let's expand upon the concept of lack of cooperation by examinees. And let's talk about some examples of how examinees fail to cooperate, number one, with medical treatment. Number two, how examinees fail to cooperate with diagnostic studies. And number three, how examinees fail to cooperate with the QME evaluation itself. And when you spot these phenomenon in the history, this gives you an indication that this is an examinee who may be motivated by external incentive, who may have an external motive for failing to recover to a pre-injury condition. So what are some ways that examinees can fail to cooperate with the medical treatment? Well, how about an examinee who misses appointments or who sporadically attends their appointments? They don't attend every single appointment. They attend maybe every other appointment, every third appointment, or they have sporadic attendance at their appointments. Is this the type of examinee that displays a motivation to get well? Don't motivated patients attend every single treatment session? Yes, they do. How about an examinee who's frequently late for appointments? And when the examinee is late for appointments, perhaps cannot receive the entirety of the planned treatment for that day because the treatment appointment was shortened due to their tardiness. This is something that you're going to see as a recurring theme over and over again. How about an examinee who fails to get their prescription medications filled? Or if the examinee gets their prescription medications filled, fails to take the prescription medications. And I can't tell you how many times in the medical records I review these drug testing screens, these urine drug testing screens, that fail to demonstrate any of the metabolites associated with the prescribed medications. And the examinee is not taking the prescribed medications. They're failing to cooperate and failing to participate with the prescribed treatment program. They're failing to follow the expert medical recommendations of doctors who are intent and motivated to help them, sincerely help them to get well. How about an examinee who reports side effects, intolerable side effects, to every single medication that they're prescribed? They are prescribed medication A, and they report intolerable side effects. And then they're prescribed medication B as a substitute, and yet even medication B produces intolerable side effects, and medication C produces intolerable side effects. And these examinees have a reason to refuse to take each and every medication that's prescribed to them. How about examinees who refuse procedures? Who refuse procedures that are designed to help them and to help them to get well and to help them to recover to pre-injury condition. Let me ask you, if your child had a serious health condition and a medical professional recommended a procedure, the purpose of which was to help your child to overcome this medical condition, what is the likelihood that you would refuse such a procedure? And yet, in workers' compensation, we see all the time examinees who refuse procedures. They refuse injections. They refuse electrodiagnostic testing, which is invasive and involves needles. They refuse epidural injections. They refuse radiofrequency ablation procedures. They refuse surgical procedures. What is the unspoken message conveyed with an examinee who refuses medical procedures recommended by expert medical providers who have a sincere desire to help their patient to recover? What message does that convey non-verbally when an examinee refuses procedures that are designed to help them? How about an examinee who misses therapy appointments, who cancels therapy appointments, who misses chiropractic appointments, who cancels chiropractic appointments, who misses acupuncture appointments, and tells you that the reason they miss or cancel those appointments is because that treatment, whether it be acupuncture, chiropractic, physical therapy, made them worse? Have you ever had a case where you have an examinee who attended one physical therapy session and did not return to physical therapy because the first physical therapy session made them worse, or one chiropractic treatment made them worse, or one acupuncture treatment made them worse? How often does this happen? In your clinical practice, if you're a physical therapist, if you're a chiropractor, if you're an acupuncturist, this never happens. This never happens. In our clinical practice, we don't have patients who discontinue treatment after one treatment session claiming that the treatment made them worse, but in workers' compensation, we seem to accept this in the normal course of business, and we hop, skip all around to try and provide examinees with new and different forms of treatments for examinees who may have external incentive or who may have external motive for failing to cooperate with the treatment program. Is this possible? Well, let me just give you a couple of examples on a case I recently did. These are some Kaiser records that I have in front of me here. And the first one I want to share with you is a Kaiser physical therapy note regarding this examinee. It says, the patient has failed to return for scheduled follow-up treatments prior to attainment of the treatment goals as outlined in the plan of care, and therefore he or she will be discharged from physical therapy. So here we have an examinee who's enrolled in physical therapy but failed to attend or schedule follow-up treatments, and therefore the physical therapy department is so frustrated that they cannot get this examinee back to attend their appointments that they've discharged the examinee from the physical therapy program of care. Now, always ask yourself, how would a sincere examinee behave when they're scheduled for physical therapy appointments? Do you think Tom Brady, when he suffered ACL tear in his knee in 2008, do you think he attended physical therapy sessions after his surgical procedure? How about Roger Federer, tennis player, in 2016 when he suffered medial meniscectomy of his right knee? Do you think Roger Federer attended therapy sessions after the surgical procedure? Sincere, motivated patients attend therapy appointments, and yet in workers' compensation, we consider it to be normal for examinees to dictate their own plan of care and to discharge themselves from their physical therapy programs. What are some other ways that examinees fail to cooperate with the prescribed treatment program? How about diagnostic studies? Diagnostic studies. And I myself am dealing now with a case that's on my desk right now that involves an examinee who, at the time of the QME evaluation, she and I agreed that x-rays were necessary. And she and I agreed that when notified, she would go for the diagnostic studies immediately, and she agreed to this. Well, it's now 2 weeks after the date of that evaluation, and despite daily calls to the examinee refuses to go for the diagnostic studies. And the report is due out in 2 weeks now, and still we're waiting for the examinee to cooperate with the request for diagnostic studies. Now let me ask you, if you had a serious health condition, something that was causing you persisting symptoms and persisting limitations in activities of daily living, as this particular examinee reported to me during the QME evaluation, and the doctor recommended some diagnostic studies to help determine what is the cause of this problem, what is the cause of the symptoms, and what is the cause of these limitations and activities of daily living, what would you do? What would patients in your clinical practice do? They'd get the diagnostic studies. And yet in workers' compensation, we have examinees who apparently aren't that concerned about their condition. They're not concerned enough to attend the appointment for diagnostic studies. And I have here an example to share with you. This is again a record from Kaiser on a different examinee, and this is from the radiology department at Kaiser, and it says, this is written by the radiology department. Patient was left a message, no response, referral closed per radiology protocol. So the radiology department has called this examinee on several occasions, and the examinee has not responded to their appointment for diagnostic studies. So one way that examinees fail to cooperate with diagnostic studies is they don't attend those appointments at all. Well, how about examinees who do attend their appointments for diagnostic studies but don't comply with the instructions related to the diagnostic studies? Now, you may encounter this in your radiology reports. This is particularly common in radiology, where the medical radiologist will comment in the body of the report that the images were degraded by motion artifact. Have you ever seen that in your radiology reports, that images were degraded by motion artifact? In other words, the examinee failed to cooperate with their instructions to hold still during the diagnostic studies. How about examinees who get to the MRI facility and then report claustrophobia with getting into the MRI tube? Have you ever had examinees who report claustrophobia with the MRI tube? This is another example where diagnostic studies either have to be aborted or they have to be rescheduled for weeks or even months down the road at another facility that may have an open MRI tube, or the images or the studies may have to be aborted altogether. How about examinees who refuse diagnostic injections? Some of these injections that are available now have not only therapeutic benefits but also have diagnostic benefits, and examinees have the moxie to refuse medical procedures recommended by their doctor, the purpose of which are designed to help elucidate and illuminate the cause of the examinee's complaints. And I shared with you an example where the radiology department gave up in frustration in trying to schedule the examinee for necessary diagnostic studies. Well, that brings us finally to failure to cooperate with the QME evaluation. Is it possible that examinees can fail to cooperate with the QME evaluation, can fail to fully participate? Is it possible that the examinees can come to the QME appointment and intentionally produce false or grossly exaggerated physical symptoms? Is that possible? Well, it is possible, and this is a theme that you're going to see recurring over and over and over again throughout the course of your career as a qualified medical evaluator. So, what are some of the ways that examinees fail to cooperate with the qualified medical evaluation? Well, from my recent experience, I want to tell you about an examinee who I myself had about a month ago. And in the days leading up to the evaluation, I of course attempted to control as many of the variables as possible. So I called the examinee and I advised the examinee that during the appointment she would need to bring a pair of shorts and a tank top so that we could examine the upper extremities and the lower extremities. That she was to bring some clothes that she was comfortable in, but that allowed visualization of the arms and the legs. The examinee was advised to attend the appointment or to arrive at the appointment 30 minutes early in order to meet with the interpreter. And if the examinee needed help in completing her paperwork, that would be the time that the interpreter would be available to help with the paperwork. And the examinee agreed to all of the above. Well, on the date of the evaluation, both I and the interpreter showed up 30 minutes in advance, but the examinee failed to show. At the time of the appointment, 30 minutes later, the examinee failed to show. We waited and we waited. And we made phone calls and there was no reply. And 35 minutes later, just as the interpreter and I were packing our bags and closing up our show, the examinee showed up. 35 minutes late, which was actually 55 minutes later than agreed upon. Of course, the examinee did not bring shorts. She did not bring a tank top. She did not bring her paperwork already completed. In fact, she did not bring her paperwork at all. And we had to start with brand new papers that took her and the interpreter an additional 30 minutes to complete. And so the appointment actually began 90 minutes later than agreed upon. Would you agree with me that these examples represent bona fide examples of failure to cooperate with the program, failure to cooperate with the evaluation? Additionally, when I asked the examinee for a photo identification, I knew she did not have a California driver's license, but I expected some other type of photo identification. She informed me that she was unable to provide any form of photo identification, and I considered that to be an additional example of failure to cooperate with the evaluation. Well, what are some other ways? They no-show for appointments, they're late for appointments. You know, and if an examinee is late for an appointment and the appointment needs to be rescheduled at some point 4 weeks, 6 weeks into the future, that could extend their period of temporary disability as much as 4 weeks, as much as additional 6 weeks. It's tremendous cost and that extension or that rescheduling of that appointment. They come to the evaluation with the paperwork not completed, despite instructions to complete their paperwork. Who does this? Who does this? When you have an appointment with a specialist and the instructions are to bring to the evaluation your paperwork completed, what would you do? What do patients in your clinical practice do? They complete the paperwork, correct? Correct? And yet in workers' compensation, we seem to consider it to be okay. It's acceptable. It happens. It occurs all the time where examinees show to the appointment late and they show with their paperwork not even completed. What are some other ways? Well, examinees can fail to participate in the exam. They can express allodynia during the exam, which is exquisite pain to a stimulus not consistent with the level of pain. Allodynia. They can refuse to allow manipulation of the legs or other body parts. They can provide non-physiologic responses to examination maneuvers. They can provide inaccurate responses to symptom questionnaires and activities of daily living assessments. And they do this all the time. So let me give you an example from a recent QME report wherein the doctor, with his flowery language, attempts to convey to the reader of the report the level of cooperation of his examinee. So let me just read a couple of things to you from this recent qualified medical evaluation of another doctor. He says, on June 13, 2017, the qualified medical evaluation began at 9:40 a.m. and concluded at 11:45 a.m. Mrs. Jones became hysterical and crying, so it was necessary to contact her daughter to pick her up. Hysterical and crying. Comment. It was necessary to contact her attorney and notify his office staff of their client's condition and inability to continue with the evaluation, and that the evaluation would be continued on another day. On this other day, after considerable phone calls, she agreed to attend. Okay? So on this other day, again, it was necessary to call the attorney's office and again have his staff instruct Mrs. Jones to perform the required orthopedic and neurologic tests, since she was unable to even move her neck or lift her right arm without catatonic condition, trembling of the entire body, grimacing with all motions, and screaming or moaning with any motion. And what the doctor's conveying here with this description is that the examinee was failing to cooperate, failing to sincerely cooperate with the qualified medical evaluation, perhaps because she had external incentive or external motive for failing to admit that her condition had fully recovered to pre-injury condition, which would then therefore qualify her for a permanent impairment evaluation. So doctors, these are some frank topics that I share with you because over time you're going to experience these phenomenon as recurring themes throughout your qualified medical evaluation. Now, one of the distinct differences between patients in your clinical practice and patients in the qualified medical evaluation practice is that patients in the clinical practice are motivated to get well. See, Tom Brady was motivated to get well. Roger Federer was motivated to get well. Well, in the workers' compensation system, examinees have every motivation to not get well. It's a different cat. It's a different system, and the system rewards and incentivizes examinees to not get well. When examinees get well, they receive no benefits. When an examinee has ongoing symptoms and ongoing limitations with activities of daily living, they receive all the benefits, including total temporary disability and permanent disability awards. So there's a great disparity between patients in our clinical practice on the one hand and patients in our QME practice on the other hand. And one of the recurring themes that you're going to see throughout the course of your evaluations, at least as relates to medical treatment, are that examinees have failed medical treatments. They've failed to fully recover to pre-injury condition, and it's because in many cases they fail to fully participate in the treatment program that's designed otherwise to help them get well. So doctors, I hope this helps you. This is another example of the recurring themes that you're going to see over and over again with your examinees. Now, over time, as you start to accumulate qualified medical evaluations, and you have done 100 or 200 or 300 and 500 evaluations, you're going to start to see these themes recurring over and over. I present these to you now so that you don't have to reinvent the wheel, so that you can spot these as they occur in real time with your examinee, and it will help you understand the external motive that may be operating within your particular examinee, so that you can provide the appropriate opinions and conclusions within the body of your report. And by appropriate opinions and conclusions, I'm referring to opinions and conclusions that are a true and accurate reflection, neither overstated nor understated, but they're true and accurate reflection of your examinee's true condition. Okay, so I hope this helps you. In our next session, we're going to talk about another of the recurring themes that we see over and over again involving medical treatment, and that has to do with examinees who pursue medical treatment outside the medical provider network. And I'm sure that discussion is going to blow your mind. It's going to blow your mind. It will open your eyes newly to a branch of our industry that you never even suspected could exist, let alone suspect that it did exist. Okay? So this is Dr. Perry Carpenter. I want to thank you for joining me on today's discussion. Look forward to being with you on future discussions as well. And for now, I'm wishing you best of success in your career as a qualified medical evaluator.